job right.
Uh-huh. You've covered enough, JT. I don't think you have to work on this case anymore.
Well, shouldn't we know all the details for the report?
Just step aside. This was just practice for you, JT. I'll be doing the complete exam and the report.
Oh, come on, Polly. Let me do it. I can do it.
Oh, am I early?
Not nearly enough.
Looking good.
Thank you. Lock up, JT?
Sure. Have fun.
Thank you.
All right, it's just you and me, kid. Dad?
Oh, no.
Say hello to Mr. Sunshine.
Oh, thanks a lot. Oh, God. Amazing how a 5-minute nap can turn into an hour. Rounds in 10 minutes.
Do I bother checking with Dr. Toledo, or is she in the same shape that you are?
Oh, we're not very funny this morning, are we? Just remember, pal, I am a father who still believes in corporal punishment.
Ah. Dad, I may be an idiot for bringing this up. I mean, I'm not perfect myself.
Oh?
No, I don't know.
What?
Well, never mind.
You sure?
Yeah, it's no big deal.
Okay.
Well, yeah, maybe it is. No, never mind.
Oh, come on. You got something you cross. Spit it out. Say it.
Well, if one of our surgeons messed up a case, you'd want to know about it, right?
Right? Messed up how?
Well, I'm working pathology this month, and we had this autopsy.
Oh, well, then we'll find out as soon as the autopsy reports cross my desk.
Yeah, well, it's not going to cross your desk for a while. I mean, this isn't a coroner's case. This is something the family gave us permission to do. So Dr. Toledo hasn't finished it yet.
Who's the surgeon?
I don't know. See, dead is dead, but in medicine, we're supposed to learn from our mistakes, right?
Oh, come on. Don't throw my own lectures back at me. I'll talk to Polly. If there's a rotten apple in the barrel, we'll dig it out.
Mac, excuse me, please. What does this mean, this letter? It says that I can't operate for 1 week. What's going on?
Well, just that. Operative mortalities, post-op complications. You've had too many. I mean, there'll be a board hearing. You can have representation.
All right, there's been some unusual complications the past few months, but that happens.
Look, I am not happy about this part of my job, but I can't ignore your records.
John, we go way back. Come on.
The committee will review your charts. Some recommendations will be made, perhaps some CME, some proctoring.
I'm not one of your damn residents, McIntyre, and I won't stand for somebody looking over my shoulder every second.
Well, that's the way it is. It was brought to my attention.
Jackson.
I recommended it to the board.
Let me tell you something, sweetheart at Memorial Hospital. Don't think that there won't come a day when you won't stink.
Is it a sty or something?
No. Your eyelid droops. Your right eye doesn't move properly. That's a third nerve paralysis. I'm afraid you've had a little stroke.
He's about 5'8" to 5'10", 200 pounds, about 50 years old. Mediterranean Spanish, I would think. Uh-huh. Well, it was pretty well preserved in the concrete, but not well.
Oh, this is the infamous Jonah's hand everybody's talking about, hmm?
Don't tempt the gods. Everyone who touches that thing comes into grief.
Jimmy Hoffa?
Especially the owner.
Sure, could be.
Now, I have a confession to make. I'm a little superstitious myself. I am superstitious of avoiding superstitions. So, you being one to have a certain proclivity for daydreaming and signs and apparitions, maybe you should get lost while I have a little tete-a-tete with Dr. Toledo.
Certainly.
Well, if you're looking for me, Sergeant, I'll be right here at Memorial. Okay. Thank you. Bye. Can't stay away, huh?
Business, not pleasure.
Oh, come on, Trevor. I can't help it. You've got this effect on my inner demons. You know what? I think we've got something here. Why don't you lock the door and we'll get a little primitive, huh?
Go on, cool it. Cool it.
Come on, look me straight in the eye and say no.
No.
Say no, no.
Come on, Bobby. Be serious. Look, honey, I brought you here to do a job. I mean, if there's any indication of medical incompetence or any of my staff screws up, I need to know about it.
I thought you weren't going to interfere. You were going to let me run this lab as I see fit.
That's right, but you know you wouldn't be doing your job if you let a surgical error go unreported.
Your son has a big mouth.
I know that. He also has a sense of ethics, which I am proud of.
Trapper, drop this. Just drop it. It's not important.
Come on, Bobby. Let's see the body. Wait a minute. I know her. It's Mrs. Ramirez. I did surgery on her 3-4 weeks ago.
She hemorrhaged from a traumatic pseudoaneurysm. I think you may have nicked the vessel wall, Trapper.
I'd like to read the report.
Haven't finished her yet. Wasn't a coroner's case. I'll need more time. Besides, I didn't want to give you any grief.
Finish her up right away.
You're not gonna like it.
Just do it and send it to me. Send one to the committee.
Housekeeping to 4 West. Housekeeping to 4 West.
I'm sorry. Mr. Wiley passed away.
What happened? He was getting better, we thought.
Well, he went into shock. His blood pressure dropped, his heart rhythm deteriorated. We couldn't bring him back. I'm really sorry. We did the best we could.
Never thought the wild man would go like this.
Frankly, neither did we.
Damn it, what the hell happened?
Now, just cool it.
Well, his symptoms weren't quite textbook. We never really got a handle on exactly what
It's a crotch.
Shut up! Just shut up. Okay, what happens now?
Turn him over to the coroner. Try to find out exactly why he died.
He died because he ran into the Mounties.
Yeah. Now they're gonna get just what they've been asking for.
Fighting is not going to bring your friend back. It's not going to solve anything.
We don't fight to solve anything. We fight to win.
What the hell is this?
Self-explanatory.
Don't blow smoke at me, McIntyre. I am up to my haunches in budget cuts and a possible orderly strike. Your nobility in my in-basket I don't need.
Primum nocere.
I need it less in Latin. Spill it.
First, do no harm.
Do no harm. That woman, Jan Brown, her tumor isn't getting any smaller.
I had a similar procedure a few weeks ago. I just found that patient in the morgue.
So what are you thinking, that you killed somebody?
Maybe, but I'm not going to be a hypocrite. I could have made a mistake.
Then leave some room to assume you might not have. Humor me. I can't stand arguing with saints.
When I come across a surgeon who may have dropped the ball, it is my job to recommend that his surgical privileges be suspended. I'm doing my job. The review board will do theirs.
And if the board finds against you, what are you going to do, quit medicine? Damn you!
Dr. McIntyre, call hematology stat. Dr. John McIntyre, please call hematology stat.
You're the pain rehab nurses.
Yes.
Good. Down the hall and to the left, please.
Thank you.
What is this, Gang Central?
We needed a place, Stan.
Well, we are not the meeting place for the Elks, the Vets, or the PTA, and we are certainly not the meeting place for these people. All right, excuse me, gentlemen. I'm sorry. You're gonna have to disperse. Please, let's break it up, fellas. All right, everyone out. Excuse me, man. Everyone disperse.
Maybe you ain't
out.
gonna be
now.
riding point no more, Wiley.
But we ain't gonna forget